So I'm here today with John Casey, Director of International Benefits for Google. John, what's it like working for a company like Google who's innovating and changing the future?
Google is a very special place. The culture, I think, I've never worked at a place like Google, so it's hard for me to say a blanket statement whether it's a unique culture, but it feels like it is quite unique. I think what makes it unique is it starts from the top, our leadership. Our leadership is extremely transparent, and there's an awful lot of trust amongst two employees. From allowing employees to ask questions about any sensitive topic, our leadership will answer it. And certainly in my experience, and from speaking to friends of mine, there's not that same level of transparency at every company. But that in itself actually allows Google to do great things, knowing that there's the trust, transparency, and the challenge or the responsibility that comes with that. Insofar as if someone stands up and asks a question about what are we doing in the area of wellness, the expectation is that we solve that. It's not that someone's complaining. So that's pretty important, and that allows us within my team and across our organization to drive wellness.
John, one of your initiatives at Google was to create the healthiest employee on the planet. How are you going to attempt to achieve that?
Yeah, I think the first thing is it's really a tagline. We don't sit down and seriously think we're going to get some DNA structure and create this healthiest employee. But what it does do is it gives a vision to what we're trying to do. And as I mentioned previously, within Google we want to think big. And within the area of wellness, to have that vision, to have that goal, I don't think you could be any bigger. To have the healthiest and happiest workforce on the planet. And what was interesting is we started off with healthy initially, and then we added happiness. So it's not fine to be healthy. We want to be happy. And so we made that change. So that's what we're setting out to do.
How are you combating the challenge of getting employees to engage in their health?
Yeah. It's a tough one. We certainly don't want to be prescriptive. We know that the worst thing we can do is tell people what to do. That would be a disaster within our culture. It's a complicated area. There's so many things we can do potentially, whether it be on the physical, emotional, financial, social. But we have to be disciplined and really focus on the items that are going to get the biggest impact. And that in itself is a tough measure, because what it requires us to analyze our employees, their needs, their potential needs, the programs that we currently have available, programs that aren't built yet, not even designed, not even out in the public. So some of this is going to lead to real innovation and creativity. But once we go through all of that, we really have to sequence and rank them and say, right, if we do 3 of these 20, 30 programs, which 3 make the most sense from a sequencing standpoint, but also which will have the biggest impact to our employees? And that's what we're after, and that's what we're doing. And impact, it's a difficult one because by impact, we're making this generalization and blanket statement about impact to one employee is the same as impact to another. It's not. So there's a bit of a trade-off here, which is also challenging. But that's what we're going to set out. We know we're not going to get it right, and that's okay. We're going to iterate. We're going to learn from our mistakes, incorporate it back in, and do it better next time.
How do you deal with the challenge of multinational offices? Because many employers, they are fighting the challenge of, okay, I've got one office in one location, but you actually have to engage, a culture of health in multiple countries around the world, and we all know that, every employees in any particular country or city or type of, employee or industry, they all have a different need and a different way to approach it. How do you? That's a big challenge.
Yeah, and absolutely. We're no different to the average multinational. Our employees come from different walks of life, different cultures, different countries. But there's 2 aspects to it I would comment on. One is logistically, just being able to manage programs globally. We're fortunate that within the benefits team, it is a global team. We have members of our team all around the world. So having dedicated people sitting in these regions and in a lot of the larger countries makes a big difference. But they can't do everything. So one of the points I mentioned earlier was having grassroots efforts. So getting our employees to essentially champion our cause, become wellness champions. That's ultimately how we're going to logistically get through the challenge of logistics and administration and just getting enough people involved in this movement. And that's what we're going to do logistically. The second one is culture and designing programs. Do we have the right programs there to meet the needs and challenges for those different backgrounds. And that is, we have to educate ourselves, we have to ask the right questions, we have to listen. And one of the ways we do that, which is quite effective, is we hold a lot of focus groups. So we'll have employees from China, from Brazil, Australia, all around the world, and we'll chat with them, we'll sit down with them like we are right now and ask them, what's important to you? What is the definition of health to you, to your family? How can we help you? How can we make you a better person? Simple questions. And the creativity and the honesty and the transparency, going back to what I mentioned earlier, allows us to do that, and that allows unbelievable feedback that we get from our employees to enable us to design programs. And then with the logistic support and the design, hopefully that's going to create impact for our employees globally.
So you seem to really have a good grasp at Google of how you're going to approach wellness. What advice would you give to other employers who have not, implemented a wellness program but would like to? Because many of them have the challenge of, what's the return on investment?
Yeah.
But more importantly, who do I work with?
Mm-hmm.
I know in your presentation you had that you mentioned you are very selective in your vendors. You want ones to work. That's, I think, the biggest challenge for the industry, because employers don't know where to turn.
Yeah. Just on the partnership one, we certainly are very selective in who we work with, but also we do a lot of work ourselves internally. And that can be a challenge for most companies. I acknowledge that, because we're fortunate that we have a sizable group of people. And just a moment on that, our backgrounds, the background of the folks we have on our team is quite diverse. We have a bunch of actuaries, we have a bunch of PhDs with analytics backgrounds. So we're fortunate that we have that support. We have essentially that kind of intellectual brain power that can develop some of these solutions. But for companies starting out, they don't have that, and that absolutely is a challenge. And my advice to them would be, you don't have to boil the ocean. You can take small steps. And some small steps have so much impact. And that goes back to my point about the big splashy event. Sometimes it doesn't do much. What does it really do? It creates maybe awareness, but does it last? No. If you do a simple thing like an email communication about health screening, that can change lives. So what I would say is it's a journey. You're not going to do everything in one go, and that's okay. But even one person with one email can touch somebody and change their life on wellness. And I think it's just taking that mindset, but having a plan though as well. You don't want to be a scattered approach of doing left, right, middle, be all over the place. You have to have some logic to your methodology and your sequencing. But I think once you do that, if you're one person or 100 people, you can still get impact. But the biggest advice I would give is start. Don't do nothing. Do nothing and worrying about how you're going to do it. You're never going to go anywhere. Just start. And again, if you make mistakes, we make mistakes. That's okay. Learn from them and move on. Yeah.